you that today's telecast link has been sent to the group, WhatsApp group. It is live, so you can share it to your colleagues. Today is the second day of this international conference, and yesterday we had a very wonderful and knowledgeable sessions. Today we are going to start with the presentation of Dr. Naike. She is from Sri Lanka, and the Indian resource persons, Dr. Manali Kane madam, Snehal Pendse madam, and Thorat sir. They'll be having their presentation, and immediately after that we will start with the participants' presentation. This will be the schedule of today's program. Until lunch, hope we will be finishing everyone's presentation. We'll have lunch. We will complete with the formalities of the certificates, and I think so we'll be closing this international conference. So once again, on behalf of the organizing committee, I, Dr. Atul Lakre, welcome you for the second day of this international conference, which is organized on the topic nutrition, yoga, rehabilitation, and scientific training methods for avoiding attraction of doping in sports. I request all the guest dignitaries on the stage to please come forward and lighten the photo of Saraswati. It is our Indian culture when we start with any academic activity to please worship the goddess Saraswati.
झूम केले
Today's resource person, Snehal Pendse madam, Dr. Manali Kane madam, international speaker, Mrs. Anumaratna Naike, Secretary Vidya Vikas Mandal, Honorable Vilasavati Gumre sir, President Vidya Vikas Mandal Karmala, Principal Milind Fund sir, Dr. Lakshman Patil, Principal Yashwantrao Chavan Mahavidyalaya Karmala, organizing convener of this international conference, Principal Dr. S.K. Pawar sir, Resource Chairperson Dr. Pradeep Deshmukh sir, Dr. Shatrunjay Kote sir, Gary Kong sir from Malaysia. I request everyone to please gather for a common photo. Deshmukh sir, please. I request Dr. Anil Salke sir, Balasai Vatsale sir to please accompany for a photo. Because these photos will be cherished for our lifetime. I request Honorable Vilasavati Gumre sir to please declare the second day open.
पंडित सर
आजच्या यशवंतराव चव्हाण महाविद्यालय करमाळा तसेच पुण्यश्लोक अहिल्यादेवी होळकर सोलापूर विद्यापीठाच्या संयुक्त विद्यमाने 2 दिवसाचं जे आंतरराष्ट्रीय चर्चासत्र आजचा दुसरा दिवस आणि आजच्या दुसऱ्या दिवसाच्या चर्चासत्राची सुरुवात आज आपण या ठिकाणी करत आहोत. या चर्चेसाठी उपस्थित असलेले आमच्या संस्थेचे सचिव विलासराव घुमरे सर, त्याचप्रमाणे देशमुख सर आणि आलेले सर्व पाहुणे आणि आजचं चर्चासत्र चर्चासत्राचं उद्घाटन झालं असं मी जाहीर करतो आणि ते थांबतो.
Now I request all the dignitaries to please join us on the front seats so we can start with the presentation. We have Honorable International Resource Person, Anuma Ratnanaike. She's from Sri Lanka. I request her to please start with her presentation. And I request Dr. Suresh Pawar sir and Shatrunjay Kote sir to please chair the session. सर इकडं ह्या साईडला घ्या इकडं हां हे सर 5 मिनिट हो नाही
Sure.
You can share your experience of this
I know. Slide. Yeah. Keyboard.
Just check.
Yes. Okay. Very good morning to you all. First of all, I would like to thank for inviting me in this special occasion. I think this is really honor for me to be in Solapur University. So once again, thank you, Dr. Atul and team, who organized this such a wonderful two-day international conference. especially in the field of sports, because nowadays we really need for the education scenario, because we had a very bad experience during the COVID time. Now we are moving forward. So I think once again, Dr. Atul and team, I wish you, your team, and in the future we can see more conference like this. So I will give a little bit introduction about myself. I am Anama Ratnayaka, Senior Lecturer, Head of the Department of Sports Science and Physical Education, Faculty of Social Sciences, University of Kelaniya, Sri Lanka. My specialization is sports management. I graduated from one of the leading University of Seoul National University, South Korea. I think this is good enough about myself. Let's move on to today's topic. Yoga for enhancement for health of the sportsman. I think as we know, a sport is one of the best tools, and also it is a universal tool everyone can use. Because sport without any race, without any language, everyone can use. As we know nowadays, due to the more commercialization, more industrialization, already affect to the sports. Therefore, we have to take care of sports by using different kind of tools. Like we need psychology, we need science, we need management, we need administration, we need nutrition, as well as we need yoga concept. So today I will try to explain how we can use yoga as a to improve or to empower sports. So I outline my presentation. I will answer who, what, when, where, why, how. Who? My topic basically based on the sportsmen. This means athletes. We can see different meanings, different type of definition in the world people are using. But we couldn't see exact definition who's sportsman. But for our understanding, I use a person who take part in a sport, especially as a professional. It's been like competitive sport, someone using, then we can call as a sportsman or athletes, because they basically focus on winning medal. Not just for values or other things. They basically focus on winning medal. What? I think maybe you already aware of that. The athletes, do they have those kind of qualities or those kind of skills? Did you heard before? This is come from the Olympic. Because if we talk about the Olympics, if we talk about sports, definitely we need to know about what is the Olympism. It means that's the base of sports, right? So therefore, every athlete or every sportsman have to have excellence, respect, and friendship. So without this, we could not call as athlete or sportsman. Let's go through one by one. What is the excellence? In the Olympic ideal, this value refers to giving one best either on the field of play or in life. It is not only about winning, but also participating, making progress against personal goals, striving to do our best in our daily life, in benefiting from the healthy combination of strong body, mind, and will. But we couldn't say like this kind of things from in real scenario, but we have to focus as a coaches or trainers or scholars, we have to make more awareness about this. Not only winning medal. We always encourage athletes to do winning medal, but winning medal is not everything. It's not the real sportsmanship as well. Second one is friendship. Friendship is, I'm not going to explain in very deep. Through the sports, we can make many friendships. If we really need to do, or if we really need to focus, not only winning medal, definitely we can earn this kind of skills or values as well. The third one is respect. Respect for oneself and a body, respect for another, for the rules as well as for the environment. It refers to the fair play attitude that athletes should have and to their commitment to avoid doping. So athletes nowadays and coaches also same, they're trying to win sometimes using the wrong way. But we have to encourage them not to do the wrong thing, because a sport is like a religion. We can't, we can't say that just only for the focusing on win medal, we can do somewhere like using subsistence or breaking the rules. No, we can't do that. But the real scenario, we need to understand. So that's why if any person who doing sports, definitely he or she maybe earn those kind of skills, values. If you can go through this in Olympic manual, that's like a sports Bible for us. When? Normally, we know that long-term and short-term athlete development programs, but if we need to take more medals or if we need to enhance or empower athletes, we need to go for the long-term athlete development program. So during that time, during that process, definitely we can provide those values. We can train them to empower them to using friendship, excellence, and respect, those kind of value mixing with the training. So that's why I show this long-term athlete development plan, because within short-term plan, we couldn't do that kind of things, because we need to have a long journey. It's a lifetime journey, because sports not only winning. Before I also said, sport is balancing all the body, will, and mind of people. Where we can do on the ground and off the ground. On the ground, definitely we have to focus on the training. But off the ground, we have to focus on other skills. We have to teach them. We need to encourage them. We need to empower them. The sport is not only winning medal, right? But when we go to ground, we have to definitely focus on the he or she performance. We need to encourage them to basically only performance things. But off the ground, we have to do many things. Why? For the enhancement for health of the sportsman. If you Google it, you can find so many problems nowadays athletes having, like corruptions, doping, right? Rule breakings, many things you can find it. But if you look at the history of sports, it's a spiritual people are using. It's like a worship, something like worship things. But nowadays, money and commercialization bring away from different scenario. Therefore, we have to protect our sports. So therefore, we need to come up with other solution as well. How? Then I move into my topic. We have to mix with yoga and sports. We have to follow three things. First one is education, second one is training, third one is competition. During the education process, as I mentioned earlier, we have to teach them what are the values, what are the real philosophy of sports, balancing all the body, will, and mind. And then training, we have to teach them how to respect the rules, how to encourage other athletes. We are really responsible for the society. As an athlete, we are not only responsible for ourselves, we are responsible for our nation as well. Because if someone represents in an Olympic, he or she representing whole nation. Therefore, we have to take care of our nation. We have to take care of our culture. Therefore, during the training process, we also have to consider the previous sports values. And third one is competition level. This is that we can call like experiment level. It's our lab. What are the things that we learn? Then we have to see what are the progress in these third steps. Enhancement for what? Enhancement values of sports. Health. Health means not only food, not only nutrition. We have to consider all the physical, mental, and social well-being. So sportsmen, we have to reduce the list of problems. Because if they educate, definitely we have to reduce all the barriers and all the difficulties that they are facing. They are not going to do wrong things. Therefore, we have to reduce the problem of sportsmen. And sports and yoga, how we can mix it? The sport has its own unique qualities to develop the mankind of the world, to enhance the spiritual contribution of the sports, and to achieve the significant roles of the sport. Yoga has the magical power for balancing the physical and mental components of a sportsman is virtual at this hour. So I think you already aware of the benefits of yoga. It's balancing all the body, will, and mind. It's really connect with the real sport philosophy. So in the yoga is considered as the most natural way of practicing a healthy life, is controlling both mind and physical nature of a person. The most of the research scholars also mention that yoga will affect to balancing body, will, and mind. That is one of the best medicine, best nutrition we can use to develop, to empower athletes. Therefore, we have to use as a tool for yoga techniques for the empower athletes. He or she can have a balance in their body, will, and mind. Yes, definitely we have to use for yoga techniques. Yoga and sportsman health. So yoga, this is based on the research article. I found that using the yoga techniques and yoga as for the training methods, it increased power, better endurance, better balance, better injury prevention, enhanced recovery, improved focus. Those are more than that we can earn good things. But basically, I found that these are the good things athlete can earn. So therefore, I advise all the physical education teachers, coaches, referees, we have to move forward with yoga. Because we are looking at different kind of things, different kind of tools, but yoga is the only medicine or only tool that we can use because it is very cheap. We don't need more money to do yoga things. Anyone can use it. I think nowadays we can see in our country also making more awareness about the yoga. So we are offering yoga diploma as well. It means that much of important for yoga, not only athletes, the whole nation and people like us. Olympism. As I told you, what is the real sportsmanship, balancing all the body, will, and mind. This Olympism is that's the philosophy of sports. We have to aware this because without philosophy, we can do something, but if we need to earn real sports thing, definitely we have to based on philosophy of sports. This already mentioned in the Olympic Charter, that's called Olympic Manual. It's mentioned that, right? If you are not using this Olympic Charter, please go through it. We can see real sports. What is the real meaning of sports? How we can develop sports? What are the real factors that we have to get from by using sports? Olympism is a philosophy of life, exciting and combined in a balance all the qualities of body, will, and mind. The yoga also same, the balancing all the body, will, and mind. I'm not going to read all the sentence, but I just want to share this is the philosophy of sports. Without this, we can do something, but if we need to earn real sports thing, definitely we have to based on this philosophy. Whatever the programs that we are arranging, yes, definitely we have to follow this Olympism. That's why I want to mention here the enhancement of athlete health. Yes, we have to teach them the real philosophy of sports. Again, I would like to say, because I always line up my topic, because yoga and sports. Balancing yoga and sports together, definitely we can produce good athletes. Not only they can earn for the medals, they can earn for the society. We can produce good human being. We can earn good personality. We can use as a brand image if they are real athletes. So without having values like friendship, respect, excellence, we couldn't use a real athlete for the benefit of our society. Concluding my presentation, I would like, this is my own conclusion based on some research article as well. I would like to conclude by observing the above factors clearly. It is clear that yoga has the magical power to create a successful sport person with good health while improving the spiritual understanding of their lives. Another one is, in sport management should go beyond the winning concept, but for the returning to the society. In this scenario, the yoga has a power to enhance the sports, providing its unique training for both physical and mentally of the sportsman. Thank you.
Thank you, ma'am, for the enlightening presentation. Dr. Anuma Ratnaike, she is senior lecturer in the Department of Sports Sciences and Physical Education, University of Kelaniya, Sri Lanka. She has delivered her lecture on yoga and enhancement for health of the sportsman, in which she has enlightened us with the 6 W and 1 H, that is who, why, when, where, which, what, and how, to find out the rational and logical answers to the questions which are prevailing in the society. Then she also elaborated on who is a sportsman, the core values of Olympics with excellence, friendship and respect. Yoga and sports is based on education, training and competition, importance of yoga in relation to sports performance enhancement. And she concluded with the findings of her research. I thank you very much, ma'am, for enlightening this session. I request the dignitaries to have an open session for question and answers. So anybody having questions can raise their questions and she is ready to answer. Thank you.
My question is what is the proper diet for a sport person?
Sorry?
Proper diet for a sport person.
Proper diet.
Diet.
It's depend on the sport. Thank you so much for your question. Actually, proper diet mean it's depend on the sports. It's depend on the athlete, right? If I'm wrong, you can correct me. So basically, diet mean not reducing food, not for reducing only food, but we have to balance with our meal. At the same time, we have to include our other things like education and relaxation. So all the things we have to mix with. Those are the ingredients of diet, what I expected. Okay.
Anybody with questions? So I think no questions from the delegate side. So once again, I thank you, ma'am, from the organizers. Thank you very much for the splendid presentation. Thank you.
Thank you, everyone.
Now I request Dr. Snehal Pense madam to please come up and give a presentation.
लाईट आहे का इथे? लाईट नाही आहे ना सर इथे? लाईट नाही आहे ना? पहिली स्लाईड घ्या. पहिली स्लाईड घ्या.
पहिली स्लाइड.
नाही पहिलं नाव
लाईट लागली का?
नाव नाही लागत आहे.
बरं. इंट्रोडक्शन काय?
पहिली घ्या ना माझ्या नावाची. माझं नाव आहे पहिला.
हां हे
हां
हां सुरू करा मॅडम.
हां.
ही लाईट चालू आहे. इथली लाईट चालू आहे. तुम्ही इंट्रोडक्शन द्या मॅडम. हे लाईट बंद आहे.
ठीक आहे. ठीक आहे मी लावते ओके ठीक आहे गुरुर्ब्रह्मा गुरुर्विष्णू गुरुर्देवो महेश्वरः गुरुः साक्षात् परब्रह्म तस्मै श्रीगुरवे नमः. Very good morning to all. My topic is yoga for peace of mind and athletic performance. All respected doctors are here, and it is always a great honor to take part in such programs because it is the need of the hour. As we know, the theme of this conference is yoga, nutrition, scientific training methods, and rehabilitation for avoiding attractions of doping in sports. My topic is yoga for peace of mind and athletic performance. Let us first understand the three words. What is yoga? What is peace of mind? Then we'll move to usefulness of yoga in improving the athletic performance. Next. Yoga is derived from Sanskrit word yuj, yujyate, that is to unite. To unite what? Body and mind, Atma and Paramatma. Here are some definitions of yoga from old scriptures. From Bhagavad Gita, Samatvam Yoga Uchyate. Yoga is a balanced state. Balanced state of what? Of body and mind. Yoga Karmasu Kaushalam. Excellence in action is yoga. It is related with the athletic performance. Indriya Vashitvam Yoga. Senses are controlled by yoga. All the senses are used to increase the athletic performance. From these definitions of yoga, we can say yoga unites body and mind by way of controlling the senses. 5 sense organs: eyes, ears, nose, tongue, and skin. And 5 action organs: mouth, feet, hands, anus, and genitals. And 11th is mind, and output are excellent. Next. To achieve this or gain this, what is required? Peace of mind. What is peace? Peace is freedom from disturbance. It is tranquility or reality. What disturbs the mind? Mind in psychology is the set of faculties responsible for all mental phenomena, which includes thought, imagination, memory, will, and sensation. Next. With this context, we will discuss the 3 levels of mind. Conscious mind contains all of the thoughts, memories, feelings, and wishes of which we are aware at any given moment. Subconscious mind is the part of our mind that makes decisions without our needing to actively think about them. For example, breathing. Unconscious mind is defined as a reservoir of feelings, thoughts, urges, and memories that outside of conscious awareness. Within this understanding, most of the contents of the unconscious are considered unacceptable or unpleasant, such as feeling of pain, anxiety, or conflict. Unconscious mind continues to influence behavior even though people are unaware of these underlying influences. This knowledge is most important while winning the game. All the 3 levels should be truly pure to give the best from innermost without outside resources. Next. For this, only body or only mind is not enough. Athlete should be healthy in all respects. World Health Organization defines health as a state of complete physical, mental, emotional, social, and spiritual well-being, and not merely the absence of disease or infirmity. In old scriptures, Taittiriya Upanishad explains the 5 sheets of personality. Exactly the same. Annamaya is physical, that composes the outer layer. Pranamaya is vital energy, breath or life force sheath. Manomaya is mental sheath within Annamaya and Pranamaya. It represents psychological or emotional layer of personality. Vijnanamaya is intellectual sheath, that is intelligence layer, and Anandamaya is the source of relaxation. Revitalization gives Anandamaya. It brings body, breath, mind, wisdom, and spirit into harmony, promoting overall health, which is required in athletic performance always. Next. When it can happen? When all these sheets are purified. Let us see how they can be purified. Annamaya kosha is purified by yogasanas and healthy and pure diet. Pranamaya kosha is purified by Kapalabhati, Anulom Vilom, Brahmari and yogic breathing. Manomaya, which is most important in our life, can be purified by meditation, positive thinking, following yogic ethics, that is yamas and niyamas, bhakti yoga and karma yoga. Let us take a brief look at yamas and niyamas. Yamas, which explain how to live in society or community by way of ahimsa, satya, asteya, brahmacharya and aparigraha, that is non-violence, truthfulness, no stealing, celibacy and non-possessiveness. All this is required when a true sportsman is there. Niyamas to be followed are Shaucha, Santosha, Tapas, Swadhyaya and Ishvara Pranidhan, that is cleanliness or purity, contentment, self-discipline, self-study and surrender to a higher power. If any person follows these rules, definitely he is remembered by others. Vijnanamaya kosha is purified by let go of what? Of ego and pride. Last one or innermost is Anandamaya kosha, which is made up of happiness. Next. But it is not so easy to be completely healthy. As we have seen, mind is a big obstacle. In Bhagavad Gita chapter 6 verse 34, Arjuna says, Chanchalam hi manah krutva pramathi balavad dridham tasyaham nigraham manye vayoriva sudushkaram. The mind is very restless, turbulent, strong and obstinate. It is more difficult to control than the wind. Next. In next verse 6.35, Lord Krishna answers to his question. Asaushayam mahabaho manodurnigraham chalam abhyasena tu kaunteya vairagyena cha griyate. It is undoubtedly very difficult to curb the restless mind, but it is possible by constant practice and by detachment. Yoga Vasishtha also says, Manah Prashamana Upayaha Yoga Ityabhidhiyate. Yoga is a mean for quietening the mind. Sage Patanjali in his Yoga Darshan also says, Abhyasa Vairagyabhyan Tannirodha, means mental modifications are restrained by practice and non-attachment. Practice is required and non-attachment is also required in athletic performance. Yogic methods are very subtle and skillful and does not use brutal force. Next. We'll discuss some yogic practices which are useful for betterment of athletes. These are asanas, pranayamas, kriyas, and meditation. Next. Asanas. They are certain postures that stabilize body and mind. So, they are, we can say, psychophysical. They aim at establishing proper rhythm in the neuromuscular tonic impulses and improve the general tone of muscles by compression, stretching, and twisting. Next. Veerabhadrasan, Sarvangasan, Dhanurasan, and Ardhamatsendrasan are some of the asanas which strengthen your thighs, backbone, abdominal muscles, and increase your lungs capacity. Next. Pranayama practices are useful to control respiratory impulses, which form one of the main channels of the flow of autonomic nerve currents. They bring control over autonomic nervous system and reduce mental fluctuations. They are deep breathing. Inhale and exhale for 2 to 5 times in a minute with both the nostrils. Nadi Shodhan Pranayama for balancing the flow through both the nostrils. Brahmari Pranayama, which creates soothing effect on the nervous system. It relieves stress and cerebral tension, reduces anger, anxiety, and blood pressure. Omkara chanting, Akara, Ukara, and Makara, and Om, Omkara, releases even very subtle tensions. Next. Kriyas are purificatory processes classified into 6 divisions, often called Shat Karmas. These should be done for the balancing of the 3 doshas, that is Kapha, Vata, and Pitta, that is flame, wind, and bile. They not only purify the internal organs but also trains the reflex mechanism. Kapalavati, Trataka, Neti, Dhauti, Nauli, and Basti are their names. Trataka is useful especially to strengthen the eye muscles and improvement in focused attention, that is concentration. Next. Meditation is a yogic process of providing deep rest to our mind and body by allowing the mind to calm down to its basal states. All yogic practices are psychophysiological, so here mind dwells on a single thought of choice, reduces metabolic rate by slowing down of breath and deep relaxation to all parts of the body. All yogic practices bring all sheaths together, leads ultimately to superconsciousness as we have seen earlier. Next. Yoga Nidra. Yoga Nidra is a powerful relaxation and meditation technique derived from ancient Tantra and developed by Swami Satyananda of Bihar School of Yoga. This technique induces deep body-mind relaxation with the ultimate goal of self-awareness. Medical researchers estimate that up to 90% of illness and disease is related to stress. Whether you work too much or not at all, you still accumulate tension at the physical, mental, and emotional levels. Yoga Nidra translates as physic sleep. This practice induces complete relaxation while maintaining consciousness, where we can awaken our deepest levels of creativity and healing energies. In this state, you can ultimately change thought patterns for the better. At the start and finish of each session, you repeat a sankalpa or resolve, a short statement phrased in positive language and in the present tense. It gets embedded into the depths of your unconscious mind. For example, I am at ease in all that I do, or I am a winner, or I am on the top of the world, etc., which helps athlete to balance the nervous system, recharge vital energy, reduce anxiety and depression, improve immune system functions, improve self-esteem and confidence. Next. After knowing all these aspects of yoga and its advantages to body and mind, we'll look at the benefits to athletes. What does we mean by athletic performance? It is defined as a physical and mental effort of an individual or a sports team to win and defeat the other person or team. Here, what we have to look back, which we have seen earlier, yoga practices purifies all 5 sheaths or koshas. By following it, athlete can win the battle through steady and calm mind, through physical sheath, that is by utilizing his body. All worldly matters seem very small to him at that moment. For sportsmen, pressure of performance, importance of competition, environmental conditions are not the problems. The problem is their reaction to such situations. This reaction can be significantly self chosen. Yogic techniques help in achieving perfect physical and mental harmony and harmony with the surroundings also. In all yogic techniques, the emphasis is on absolute equilibrium and conscious control of emotions. The basic principle of all yogic techniques is to achieve an increased state of concentration and awareness. For example, archery, gymnastics, etc. Next. There are 2 ways of leading our life: prayas and shreyas. Prayas is pleasant, which is attractive and tempting. Shreyas is good, which serves our higher purpose, liberation, which is wholesome thought. Though it may not appear desirable in the beginning, prayers may look very nice in the beginning but may bring misery later. Prayer seems to make us happy temporarily. It may cause misery and trap us. Lust, anger, and greed are gateways to hell in sports. Shreyas gives us everlasting happiness. It doesn't promise anything initially but gives eternal peace and highest happiness afterwards, for which intellect is required. Real happiness comes only when there is no fear. All athletes should remember and follow Shreyas only. Sage Ramanuja's statement in this context is very meaningful. Every action that contracts the heart of the soul is bad, and every action that expands the heart of the soul is good. Next. In Bhagavad Gita, the body is compared to a chariot, wherein the soul resides as the lord of the chariot. The intellect is known as the charioteer, and the mind as the reins. Here, role of mind is very important in winning the game. By fair play or fair way, athlete should be master of his mind. By practicing yoga, means asanas, pranayama, kriyas, some meditation techniques, yoga nidra, etc., it can be gained. Scientifically, performance in sports depends upon the nervous system. If you perform pranayama properly, flow of autonomic nerve currents goes smoothly and reflex mechanism is improved. We can conclude as Bhagavad Gita says, Karmanye vadhikaraste ma phaleshu kadachana. Next. Karmanye vadhikaraste ma phaleshu kadachana. Believe in yourself, do your karma or action, and success will follow you automatically. This is the message to the athletes. Heal yourself and your destiny through yoga. This is what I want to say about the peace of mind and athletic performance. I would like to convey my humble thanks to Yashwantrao Chavan Mahavidyalaya Karmala, chairpersons, Dr. Abhijit Jagtap sir, Dr. Atul Lakde sir, for giving me such a beautiful opportunity to speak about the role of yoga in peace of mind and athletic performance. Thank you.
Thank you very much, ma'am. We have just now enlightened by Dr. Snehal Prince Madam on the topic Yoga for Peace of Mind and Athletic Performance, wherein she has deliberated or expressed on the peace of mind, 3 levels of mind, that is conscious, subconscious and unconscious mind, sheets of personality, purification of kosha, what is mind in old scriptures, how to control the mind by expressing the Sanskrit shlokas from Gita, yogic practice for athletes like in relation to asanas, kriyas, pranayama, meditation. In meditation she has expressed on Trataka and Yoga Nidra, athletic performance, the feelings, pleasant feeling and the bad feeling, external peace regarding misery, action-oriented concepts, egolessness and angerlessness qualities in the sportsman, and finally she concluded her session, the heal through yoga. Thank you very much, ma'am, for inviting this session. I will add up something in relation to Vipassana for what you said, that everything is action-oriented. So in Vipassana they have said that avidya pachaya sankara, sankara pachaya vinyana, vinyana pachaya namarupa, namarupa pachaya sadayatan, sadayatan pachaya fassa, fassa pachaya vedana, vedana pachaya tanha, tanha pachaya upadana, upadana pachaya bhav, bhav pachaya jati, jati pachaya zara, maranam, so paride dukkha, domanasya upayasa sambhavanti, evame tasya kevalasya दुख खंडस्य समुदय होते थी. अर्थात ये सब the thing is that what is action oriented, अविद्या यत्वेव असेच विराग संकार निरोधा, संकार निरोधा विज्ञान निरोधु, विज्ञान निरोधा नाम रूप निरोधु, नाम रूप निरोधा सडायतन निरोधु, सडायतन निरोधा फस्य निरोधु, फस्य निरोधा वेदना निरोधु, वेदना निरोधा तणहा निरोधु, तणहा निरोधा उपादान निरोधु, उपादान निरोधा भव निरोधु, भव निरोधा जाति निरोधु, जाति निरोधा जरा मरणम शोक परिदे दुख दो मनस्य उपायासा निरुच्छन्ति एवमें तस्य केवलस्य दुख कंदस्य निरोधु होते थी. So to just something like this, it is from Vipassana. I thank you very much, ma'am, and I welcome all the delegates to have question sessions. So any questions? Yes, yes. Sir.
सर मराठीत विचारलं तर चालेल ना?
हो, चालेल.
कारण मॅडमच्या बऱ्याच संदर्भ संस्कृत मधले होते.
चालेल सर, चालेल.
Yoga relates with Sanskrit only.
तर आपण मांडणी अतिशय छान केली. तुमच्या आधी रत्ननायके मॅडम पण अतिशय छान बोलल्या. त्यांच्या बोलण्यातले काही मुद्दे आणि तुमच्या विवेचनातले काही मुद्दे घेऊन मला असं म्हणायचं होतं की रत्ननायके मॅडम यांनी क्रीडेचं तत्वज्ञान अत्यंत चांगल्या पद्धतीने मांडलं आणि क्रीडेच्या तत्वज्ञानाचा धागा आपण पकडलात आणि त्याला नंतर गीतेतल्या तत्वज्ञानाची जोड दिली. आता सरांनी विपश्यना ध्यान विपश्यनाचं विवेचन केलं. माझा प्रश्न नेमका असा आहे की खेळाचं जे अंतिम ध्येय आहे ते प्रेयस मध्ये अडकून पडलेलं आहे का, ते श्रेयस पर्यंत का पोहोचू शकत नाही, आणि जिंकण्याची जी दुर्दम्य इच्छाशक्ती आहे त्या जिंकण्याच्या दुर्दम्य इच्छाशक्तीतून ज्यावेळी आपण क्रीडा प्रकाराचा आविष्कार करतो आणि त्याची फलश्रुती जर हारण्यात होत असेल तर त्यातून डोपिंगची समस्या उद्भवते का, याला फिलॉसॉफिकल उत्तर काय आहे ते कृपया सांगा. आणि विवेचन आपण इंग्रजीतून करा, मला इंग्रजी कळतं.
मराठीत जास्ती छान बोलता येईल मला. आत्ताचा काळ असा आहे की पालकांना 1-2च मुलं असतात आणि प्रत्येक मुलाकडनं पालकांच्या खूप अपेक्षा असतात, त्यांच्यावरती खूप पालक गुंतवणूक करत असतात आणि मग असं वाटतं की ह्यांना त्या रूपाने तो कुठेतरी चमकावा. आणि मग ज्या शिक्षकांकडे आम्ही घालू ते जर त्याला मेडल मिळवून देत असतील तर आम्ही त्या शिक्षकांकडे आपल्या विद्यार्थ्यांना घालतो. आपण बघत नाही की शिक्षकाची क्वालिटी काय आहे आणि शिक्षकाचं इंटेन्शन काय आहे. बऱ्याच वेळेला दुर्दैवाने असं म्हणावं लागतं की शिक्षक पोटार्थी झालेले आहेत. ज्या वेळेला ते फक्त पोटासाठी काम करतात त्यावेळेला त्यांना हे माहीत असतं की विद्यार्थ्याला मेडल मिळालं की तो विद्यार्थी आपल्याकडे टिकेल, नाहीतर तो सोडून जाईल. आणि म्हणून ह्या प्रेयस आणि श्रेयसमध्ये गोंधळ होतो. तर पालकांनी मुख्यतः शिक्षकांची निवड करताना हे आवर्जून लक्षात घ्यायला पाहिजे की जो आपल्या विद्यार्थ्याला यम आणि नियम ही जी नैतिक मूल्य आहेत ही पहिल्यापासून शिकवेल. आणि शिक्षकांचीच रिॲक्शन आजकाल इतकी टोकाची असते की ती आपोआप विद्यार्थ्यांच्यात उतरते, कारण विद्यार्थी अनुकरणप्रिय असतात. त्यामुळे नाही नाही त्यांनी पार्सलिटी केली, त्याला बाहेर आला की धरून ठोकतो, अशासारखे उद्गार मैदानावरती सर्रास हल्ली आपल्याला ऐकायला मिळतात. इवन दो जरी पार्सलिटी झालेली नसेल तरी पण, की माझ्या विद्यार्थ्याचा नंबर येत नाही म्हणजे काय. या उलट काही शिक्षक असे असतात की अरे ठीक आहे, यावेळी नाही ना आला, पुढच्या वेळी येईल. मग पालकांचा आणि शिक्षकांचा पेशन्स संपत जातो. समजा सलग 4-5 कॉम्पिटिशन, आता मी खेलो इंडियाला, नॅशनल गेम्सना आणि बहुतेक बऱ्याचशा नॅशनल्सना जजिंगसाठी नेहमी जात असते. काही विद्यार्थ्यांचे म्हणजे काय म्हणू, प्रतिक्रिया इतक्या सहज असतात की ठीक आहे, जे झालं ते मी ॲक्सेप्ट करतो. आणि ह्याची बीजं त्यांच्या शिक्षकांनी आणि त्यांच्या पालकांनी त्यांच्यामध्ये काय मुळं रुजवली आहेत ह्याच्यामध्ये दिसून येतात. आणि एखादा विद्यार्थी जरी कायम हरत असेल तरीसुद्धा तो आमच्यासारख्यांच्या कायम लक्षात राहतो की किती सपोर्टिव्ह आहे, किती चांगला माणूस आहे. आणि खेळामध्ये जसं जिंकणं महत्त्वाचं आहे तसं आयुष्यामध्ये चांगला माणूस म्हणून घडणं हे तितकंच महत्त्वाचं आहे. मेडल तुमचं आत्ता असतं. मी लहानपणी नॅशनलमध्ये खूप मेडल मिळवली, पण ती गेली काळाच्या ओघात. मी आत्ता काय करते आहे, मी पुढे मुलांना माझ्या काय शिकवते आहे, ह्याच्यावरती माझी खरी ओळख होत असते. आणि ही मूल्य यमनियमांच्या माध्यमातूनच रुजली जातात. आणि तेव्हा मनाचा समतोल, हार जीत स्वीकारण्याची, गीतेतले अनेक श्लोक, फक्त 20 मिनिटाचा अवधी होता म्हणून मी अगदी थोडक्यात करून घेतलं, पण मनाबद्दलचं, मनाच्या चंचलत्वाबद्दलचे अनेक संदर्भ आपल्याला सांगता येतील की जे विद्यार्थ्यांना आपण लहानपणापासून शिकवलं पाहिजे. आणि ह्यात मला असं वाटतं की ह्या डोपिंगमध्ये शिक्षकांची भूमिका खूप महत्त्वाची आहे. शिक्षकांनी हार्डवर्क करायला मुलांना उद्युक्त केलं पाहिजे. पालकांनी अभ्यास थोडा बाजूला ठेवून त्या मुलाला जर त्या क्रीडेमध्ये गती असेल तर त्याला त्या ठिकाणी आवर्जून घातलं पाहिजे, ॲडव्हान्स ट्रेनिंग दिलं पाहिजे. आणि त्याच्यानंतर शेवटी मी जे सांगितलं ते की सुखदुःख समे कृत्वा लाभालाभौ जयाजयो, की कुठल्याही प्रकारची हार जीत त्या मुलाला स्वीकारता आली पाहिजे. आणि हे आयुष्यातलं खरं महत्त्वाचं आहे. म्हणजे माझ्याबद्दलचं मी एक उदाहरण, हा डायस नाही आहे ते सांगण्याचा, पण तरी सांगेन की शिवछत्रपती अवॉर्ड त्यावेळेला मला मिळणार होतं, पण वरच्या लेवलवरनं डावललं गेलं आणि दुसऱ्या मुलीला दिलं गेलं. तरी पण आज माझी इतकी मुलं नॅशनलला जातात की मी खूप आत्ताच्या क्षणी समाधानी आहे. ते मिळालं असतं तरी ते तेवढ्या वेळापुरतं राहिलं असतं किंवा त्याचा फक्त उल्लेख केला गेला असता की बाबा यांना मिळालं. पण आत्ता मी काय आहे, आत्ता माझं मुलांशी वागणूक कशी आहे, आत्ता माझ्या रिॲक्शन्स कशा आहेत, हे शिक्षकाच्या दृष्टीने खूप महत्त्वाचं आहे. आणि पालकांपेक्षा शिक्षक हा अगदी यमनियमांचं पालन करणारा जर असेल तर डोपिंगकडे मुलं जाणारच नाही आहेत. पण हे शिक्षक उद्युक्त करतात, त्यांना त्यांची अकॅडमी वाढवायची असते, त्यांना त्यांचं स्टेटस वाढवायचं असतं आणि अनेक कारणं असतात की जी इथे आत्ता ह्या डायसवरती बोलणं योग्य नाही आहे. परंतु तरीसुद्धा मी असं सांगेन की मनावरती ज्याचा कंट्रोल आहे त्याने जग जिंकलं. आणि ज्याचा मनावरचा कंट्रोल सुटला त्याच्याबद्दल क्रोधात भवती सम्मोह, सम्मोहात स्मृतिविभ्रमः, स्मृतिभ्रंशात बुद्धिनाशो, बुद्धिनाशात प्रणश्यती, असं होऊ शकतं. तर हे कोणीच होऊ देता कामा नये, एवढं या निमित्ताने मी आपल्या प्रश्नाच्या उत्तरामध्ये सांगेन. धन्यवाद.
थँक्यू मॅम, थँक्यू व्हेरी मच.
My question is very simple one. Ma'am, we know all the benefits of yoga. It's crystal clear, but my one doubt is there. Though it has so many benefits on physical level, mental level, even in every field performance, why yoga is not reached to the every corner of in India? It is not taught properly in primary school, higher secondary, even in higher education. then how we can get its benefits all over in India?
As all of you know or might not be knowing, last 3 years government has approved, sai has approved, ministry of youth affairs has approved yoga as a competitive game, and it is included in Khelo India and national games. Recently all are doing yoga. The government has make a syllabus of yoga from first standard, but who is implementing? Nobody. Yoga teachers even don't know how to teach yoga. Even Ayurveda practitioners, they have one subject of yoga, but they also don't know why and how to do it. This is, you know Marathi?
Yes.
Oh. जिथे पिकतं तिथे विकत नाही म्हणतात ना, तसं आपल्या इंडियामध्ये होतं आहे की आपल्याकडे ह्याची सगळ्याची परंपरा आहे, पण ते आपल्यापुरतं मर्यादित आहे. इवन दो वी आर ऑर्गनायझिंग कॉम्पिटिशन्स फॉर सिनियर पीपल, दे आर नॉट पार्टिसिपेटिंग, दे आर सॅटिस्फाईड द लेवल वेअर वी आर सॅटिस्फाईड. We are doing for ourselves only. But if a 70-year-old, 80-year-old person participates in the national games, all will inspired by him and they will start practicing for their health, at least, not as a competitive motto. But everyone should do it. We yoga people always try to tell everybody that 15 minutes at least you do yoga, pranayam, whatever you want, because you earn a lot of things in life, but you cannot gain health except doing yoga. So here the people who are gathered here, at least they should start from themselves, that I'll do in my society, in my city, and the yoga will grow. But nowadays it is expanding, and for your information, in recent 2-3 months, Asian Yogasan competitions are also going to be held. So when competitive performance is there, the people are attracted over there. But actually yoga means yogasana, all of things, and competitions are of yogasana only. So it's like gymnastics only, and no ethics. But I'm proud to say I'm going for so many nationals of yoga. There is no smoking, no drinking, no bad habits till today, from higher authorities to the children. So I think this is the yoga way all should follow in every sports.
Thank you very much, ma'am, for the enlightening deliberation. Thank you very much.
Next, I request Professor Dr. Yogesh Kora sir to please give his presentation. We are on the stage right now, which is very important for this 2 days international conference, because he is the person, or he is from that department, that faculty which is dealing with dopings, medicine, pharmaceuticals. These are the persons who play a very key role in doping. Nutrition, rehabilitation, we have already learned, scientific training methods, yoga also. But the real person, real people who have the power or can change the scenario of doping are the pharmaceuticals. So this lecture will be more fruitful to us. Hope so he will guide everyone with his honest presentation.
Thank you, sir. Organizers are very clever. After 2 yoga related sessions, they have kept Yogesh's presentation. One more thing about when I came to know about this opportunity from Yashwantrao Chavan Mahavidyalaya, and yesterday I knew why this name was given to this Mahavidyalaya. I want to highlight one more thing. I come from Patan, which is in Satara district, and my entire education right from 11th standard to my M.Pharm is done in the town of Yashwantrao Chavan. So I am from Karad, and I am proud to be a part of Yashwantrao Chavan College, Karad. I am the ex-student of that college. So here one string of attachment is already there. Now coming to the topic, uh, the conference yoga, nutrition, scientific training methods. Here, we have already gone through the yoga and nutrition part, but our nutrition is yet to be covered. Yoga is discussed today. Now I'm going to deal with the pharmacy or drug related part of the conference. So my presentation would be the sports medicine and anti-doping for sports health and fitness. Because of lack of time, I will be more giving emphasis on the anti-doping in the sports rather than the health and fitness, because it can be believed that health and fitness are the integral part of the sports, or they are the prerequisites of the sport. So because of a short duration of this lecture, we need to be the combination of Usain Bolt plus Vishwanathan Anand to understand this topic. The contents of the presentation are sports. First of all, we will understand what is the difference between the sports medicine as a general term versus what is doping, then doping in the sports health and fitness, and what are the different rules set by WADA and NADA, that is World Anti-Doping Agency and National Anti-Doping Agency, about the doping or drug related part of this. I think punishment and the regulation part was covered yesterday, so I will be more giving emphasis on the drugs. First of all, what is sports medicine and what is the doping? Sports medicine, it is an umbrella which includes different professionals concerned with enhancing the performance and healthcare of physically active individual, that is sportsmen or those who are doing exercise or recreational health activities. So basically all kind of professional, right from the orthopedic surgeon or the physiotherapist, then up to the dentist also, all professionals which are giving the medicines to a sportsman, they will come under the umbrella of the sports medicine. So basically use of sports medicine for treating the health injuries or the sports injuries or rehabilitation of a person after the injury, all these things they will come, or at the same time giving some physiotherapy for betterment of the muscular activities. So all kind of legal and rational ethical activities or the specialists, they will come under the umbrella of the sports medicine. While the doping, when we talk about doping, it is the use of banned or prohibited substances and methods. Substances as well as methods. We will enlist what are the methods which are prohibited to improve the physical and or mental performance of the sportsman. We will restrict our discussion to the sportsman only. So this is completely unethical as well as irrational in nature. So that is the difference between sports medicine. So basically all kind of specialists, right from the athletic director, athletic trainer, emergency, paramedic, primary health care, orthopedic, physical therapist, chiropractors, ophthalmologist, dentist, exercise physiologist, nutritionalist, psychologist, kinesiologist, or podiatrists. All these professionals, they will be focusing or they will be taking care of their own area regarding the increase in the performance of a sportsman. So this is one umbrella, ethical umbrella. While the doping, sports medicine, it is mainly related to injury prevention, diagnosis, treatment, and rehabilitation. Yesterday, Dr. Abhijit Jagtap sir has already talked about the sports related injuries and how they can be managed. So it is coming under the sports medicine. While performance enhancement through training, now we can enhance the performance, as madam rightly said in the earlier presentation, that the performance can be enhanced with the help of yoga or such kind of practices. So this is the legal and ethical way of increasing the performance. So psychological training, management of medical problems through the simple techniques like massage or biomedics, So that comes under the sports medicine, while the doping, it is not at all allowed, or it is strictly banned. Now, we will just go through some news updates. In Rio Olympics, we know that Rio Olympics was, it has become famous not because of the sports activity. It was famous, or it was well known for the identification of several doping cases. More than 100 doping cases were identified at the end of the Olympic, out of which two Indians were also identified. So different kind of drugs, bribery. The British doctors also claim that doctors will they will be doping 150. They have doped the 150 sports star. That was the illegal practice which was admitted. So different newspapers cover different kind of updates about the doping. One news which was there. Now, in the previous lectures, it was talked that we should control our mind to avoid the doping related activities. Now, sometimes it is voluntary doping. Knowingly, the person is gone for the way of the doping because of the pressure, peer pressure to win the medals, or such kind of psychological state will be there that I have to win and I will go for doping. That is willingly the person will go for doping. But there was a case of our famous cricketer Prithvi Shaw. Unknowingly, he administered one medicine which was containing terbutaline. The medicine was taken for just treating the cough. So at the airport, he was suffering from cough, and he took that medicine. He got that medicine from somebody, and it was containing terbutaline. Now, terbutaline is a drug, a very common drug which is used for cough, used in almost every cough remedy. And at the end of the day, what happened? Prithvi Shaw, he was identified as a sportsman with the positive doping test. Now, in any country, if we say that, oh, I was not knowing that killing somebody is a crime, I killed that person unknowingly, so don't give me death sentence. So that cannot be the excuse. Knowingly or unknowingly, if you commit one crime, the law of court will definitely punish you with in accordance with the law or regulations set by the authorities. So Prithvi Shaw was banned for a year. Similar cases were also, it has happened with Seema Punia, I think the surname I remember, Punia. She also took one tablet for the treating the common cold, which was containing pseudoephedrine. I hope that everybody knows one brand, Sinares tablet, that contains pseudoephedrine. So if you are taking Sinares tablet or any cough remedy like Mucolite, it is containing pseudoephedrine, or it is containing terbutaline, levosalbutamol, such kind of drugs, they are present in the medicine for common cold or cough remedies, very common diseases. Okay, so we, without thinking anything, we go to pharmacist and we buy it over the counter and we administer it. Okay, so such kind of things a sportsman must be aware about. So many things are there. Now, in the recent case, there was one recent case in Maharashtra, that in the Maharashtra Kesari competition also in Akluz, some chemist shops were sealed who were selling one banned drug, methamphetamine. Okay, so that was one case. At the same time, one more news was there. It was the incidents in Hadapsar, Pune, that the youth is continuously taking the same drug and it is being sold illegally. So such kind of things, FDA must look into the matter very seriously. Now, the lesson to learn, everybody knows who is this, a very great sportsman earlier, and then in a different way he is looked by the society. Lance Armstrong, he was the winner of Tour de France for several times, and after getting identified into the doping case, his entire career was destroyed. At even his own foundation, Livestrong Foundation, it was also it removed Lance Armstrong, just like I removed this from this slide. Lance Armstrong was removed from his own foundation, and Livestrong expelled him from his own foundation. So the career can be completely destroyed by one incident. Okay. Now, what is doping? Coming to the main part, that is doping. Doping is defined as the occurrence of one or more of the anti-doping rule violations set forth in Article 2.1 according to the WADA rules, World Anti-Doping Agency. The World Anti-Doping Agency, WADA, it sets the rule. Every year it updates the list of prohibited substances and prohibited methods. In the month of December or in the month of January, they release one new updated list which may include or which may exclude some previous drugs, or new drugs will be added. So at least 3 months before they declare that list, and the list will be implemented every year in the month of January. So WADA and the Indian agency, that is NADA, National Anti-Doping Agency, they look after it. So using banned substances or methods to improve physical and or mental performance, it is called as doping. Now, according to the first definition, one or more of the different rules. Now, what kind of activities are considered to be doping? So doping is defined to have either presence of the prohibited substance metabolite. Now, metabolite is one chemical. Say you administer one drug, liver will process it, liver will change its chemical form, and that metabolite may be present in your urine or plasma sample. Okay, so sometimes only the pure drug will be present, original drug or parent drug, what we call. Parent drug will be identified, or its metabolite will be identified. And interestingly, the metabolites or the parent drug may stay in our body for a very long time. Means elimination of 100% of the drug from the body, it may take several months to several years also. So even after several months, if the urine sample is taken, it may find the substance which is used by the sportsman. So such kind of techniques are also there, that if 0.01% of the drug is remaining in the body, it can be identified. Okay, so presence of prohibited substance or metabolites or markers in the athlete's sample. Sample here, it refers to the urine sample or the blood sample which is collected by the anti-doping agencies. So presence of the drug, then the use or attempt to use such kind of substances or the methods. Okay, for example, in our country, say if there is a murder, there is the provision for the punishments. There is attempt to murder, there is again provision. Okay, म्हणजे आपण म्हणू शकत नाही कुठं मर्डर झालाय, मी फक्त अटेम्प्ट केला. Okay, we cannot say like that. So attempt to use such kind of methods. Refusing to submit to sample collection after being notified. Now, in the upcoming slides, we will go through the procedure of the WADA about the testing of the drug. Here, they will notify, first they will notify the sportsman that you are identified or you are selected randomly for sample selection, sample collection, and if the sportsman refuses to give the sample, that creates the doubt why the sportsman is not giving the sample. So who will refuse it? If I have done something wrong, I will refuse it. Okay, so if I am clean, I will plainly go and I will submit the sample. Okay, so refusing to submit, failure to provide whereabouts information of or being unavailable for doping control. Whereabout information is information about your movements, or being unavailable for doping control testing. You are not present for the doping testing. You have not refused, but you have not attended the test also, not attended the collection also. tampering with any part of doping control process, if you are cheating with the process. There were incidences. Now in the process we will again discuss how the urine sample is collected. Okay, there were incidences in the history that somebody who is supposed to submit the urine sample has taken one bag of plain urine which is not containing the drug. Okay, so somebody who is not doping that particular drug, that urine sample I will take it with me and I will hide it somewhere, and I will give that urine sample to the doping officer, the anti-doping the agent will be there. So I will give a fake sample. So if this kind of cheating or tampering is done, that will also be considered to be doping, or that is liable for the punishment. Possession of prohibited substance or method. So somebody is carrying that particular substance, maybe in the stadium or during the tournament. I'm carrying one steroid tablet with me. I'm a coach, so maybe a coach will also be liable for the punishment. Trafficking or the transportation of such kind of substances, attempting to administer a prohibited substance to an athlete. This is for the coaches or the trainers. If the trainer is attempting or trainer is giving the drug substance or the prohibited substance to the sportsman, the trainer is also equally responsible. Complicity or prohibited association. Now, what are the different kind of prohibited substances and prohibited methods we will see. And before that, how these substances they are included in the list of WADA. So how the substances are included. These substances, if one of these criteria or these criteria are met by the substance or method, that will be prohibited. It has the potential to enhance or potential to enhance the sports performance. Spelling mistake is there. Potential to enhance. So if the pharmacological action of that particular substance or that particular method proves that if this is taken or this method is done, the performance will increase. So that can be, so such kind of steroids or some cannabinoids, they will enhance the performance, they will enhance the mental activity, then they will enhance the physical activity, muscular activity, or they will enhance the oxygen carrying capacity of the blood, by which the athlete will be benefited. So that can be included. It represents an actual or potential health risk to the athlete. If a particular substance is risky for the athlete, for the health of the athlete, and then it violates the spirit of the sports. So about this spirit and ethics, a lot is discussed. So all these are included in the prohibited list. Substances or methods. Okay, these are directly acting. The previous three criteria were for directly acting, while there are the substances which mask the effect or detection of prohibited substances. For example, there is one pharmacological category of the drugs which is called as diuretics. The diuretics will enhance the urine formation rate. So flushing of the body occurs at a very fast rate. If I take diuretic, normally if the urine output is 1.5 liters per day, the urine output may become 3 liters per day. More is the flushing, more will be the cleaning of the body, and at the same time, whatever drug or prohibited substance is administered by the sportsman, it will be flushed out. So what we are doing, we are increasing the elimination rate. Now in this process, the traces of this diuretic drug will be in the blood. And if that diuretic is identified in the blood, that can be considered as a doping. Means you have removed all, means कचरा सगळा टाकून दिलाय, पण तिथे झाडू शिल्लक राहिलाय, म्हणजे तुम्ही काहीतरी झाडण्याचं काम केलेलं आहे. Okay, so if such kind of practice is there, that will be considered. A substance not approved for the human use. A drug which is not yet approved, it is in the clinical phase, and if it is made available to the sportsman and it is taken, because it may be harmful to the that human being also, the sportsman, it may be harmful because the evidence of the safety is not yet established in the clinical trial. The prohibited list, as I said, it will be effective from 1st January of each year, and it will be published by WADA 3 months before. So 3 months before, the sportsman should review what is the new list and what I should not administer from this point. म्हणजे आत्तापर्यंत ही टॅबलेट घेत होतो, पण आता घेऊ शकत नाही कारण ही आता लिस्टमध्ये इन्क्लुडेड आहे. ओके, सो 3 महिन्याचा पिरियड दिला त्यांनी. सडनली 1 तारखेपासून म्हणजे 31 डिसेंबरला पब्लिश केली आणि 1 तारखेपासून नवीन रूल असं काही करत नाहीत ते. In exceptional circumstances, a substance or method may be added at any time. So exceptional circumstances will be there where WADA is having the liberty to add it at any time. Now, what are the prohibited lists? Now, there are 2 types of prohibited lists. Lists of substances and methods which are prohibited all the time, means at any point of time in any tournament, if you are taking it, it will be prohibited. While there are certain substances which will be prohibited at the time of the tournament or at a special occasion. Okay, so at all times, what kind of substances which are prohibited, let us see. There are certain categories, right from S0 to S5. The different categories are there. I will not go into the details of each of the category because it relates to the pharmacology. Now in S0, as I said in the earlier slide, non-approved drugs, the drugs which are not yet approved for the human use, they will be there. So the examples are not enlisted in the 3rd column. While S1, these are called as anabolic agent. Now anabolic agent, in simple language we call them steroids. Okay, the steroidal hormones, they increase the heart rate, they increase the cardiac output, they increase the blood circulation. At the same time, they increase the energy generation, because of which the stamina suddenly increases. So different kind of male hormones, even testosterone is one of the anabolic hormone. So or the adrenal hormones, they are the anabolic hormone. Different kind of peptide hormones, growth factors related in S2 and their mimetics. So the drugs which are used to treat anemia, or hypogonadism, growth hormone deficiency, these are included in this. Beta 2 agonists, now very interestingly, beta 2 agonists, these are commonly used in the treatment of asthma. Beta 2 agonists will increase the diameter of the bronchial tract. Okay, they will dilate the bronchial tract. More is the diameter of the bronchial tract, more air can get into the lungs and better oxygenation of the blood will happen. So more is the oxygen, more energy, more stamina. That is the relation. So beta 2 agonists are prohibited. Now one of the example I gave at the beginning, salbutamol, levosalbutamol, these are the for which are mainly used for breast cancer, diabetes. Now hormones and metabolic modulation is one of the hormone which is prohibited. Is if a sportsman is having diabetes mellitus and is on the insulin dependent diabetes mellitus, so he or she, for example, Wasim Akram, the famous cricketer from Pakistan, was suffering from the insulin dependent diabetes mellitus. He used to go and take the insulin shot during a match also. So why that doesn't come under doping? We will answer this question after the list is completed. There are certain provisions for such kind of treatments. So different hormones, diuretics and masking agent, as I said, the diuretics. Now diuretics are mainly useful, they are used pharmacologically in the treatment of heart failure or even the hypertension. If there is severe edema, that is accumulation of water somewhere, ki kute soos aali hai severely, or there is kidney failure, the diuretics will be used. Okay, so in such kind of diseases, the diuretics it is being used. There are certain prohibited methods at all time. Manipulation of M1, manipulation of blood and blood component, this is called as blood doping. Now earlier the blood doping was a concept that you donate your own blood. Okay, You donate the sportsman will donate the blood. It will be kept in the blood bank, and because the blood RBCs have the life of 3 months, after 2 months, I will take that blood to myself. I am donating and again I am taking. So what is happening? The blood volume, it suddenly increases before the tournament. More is the blood cells, more are the blood cells, more is the oxygen carrying capacity, and better will be the stamina. And it's my own blood, so nobody can detect it. So that practice was there. Now, unfortunately, more is the blood cell, viscous will be blood, and there are dangerous effect of this viscous blood on the performance of the heart. So it may also lead to heart failure. That is the risk associated with the blood doping. Now here, manipulation of blood and blood component, it is mainly done by the injection of erythropoietin, which will increase the production of the blood. The case of Lance Armstrong, it involves the use of erythropoietin. Chemical and physical manipulation, and gene and cell doping. So several different methods are there which are banned at all time, whether there is tournament or whether there is no tournament. There are certain substances which are prohibited in competition. So during the competition, several stimulants, S6 to S9 categories are there. Stimulants which are used for different kind of diseases like attention deficit hyperactivity disorder, certain psychological disorder, we use the stimulant. Even in case of cold and influenza symptoms, the stimulants are added in that cough or cold remedies. There are certain narcotics. These are the potent, very strong kind of analgesic agents. Okay. Cannabinoids or the marijuana kind of things, they are covered under category S8, and glucocorticoids, which are mostly used, a very common beclomethasone or betamethasone, such kind of drugs, they are used for normal allergy. They are also used for the arthritis kind of conditions. Okay, so reducing the inflammation is it is the correct use of these glucocorticoids. Now, here I want to highlight one thing, that sometimes it is found, even in our college also, the people come with the sample that I have got this Ayurvedic medicine, so-called Ayurvedic medicine, and it is very effectively controlling my pains or my inflammation. And we usually go to our pharmacognosy lab and we do the tests for steroids, and we find that it contains the steroids. So sometimes it happens that some fake doctors or some fake vaidya, they intentionally add the glucocorticoid tablets in their Ayurvedic preparations. Okay, so it is very important, if you are following the traditional practices for treatment, you should go to a very authentic vaidya who provides you authentic medicines. Okay. There are certain substances which are prohibited in particular sports. For example, beta blockers. Beta blockers are the drugs which are mainly used for the treatment of the hypertension. Okay, you must have heard the propranolol or atenolol, such kind of drugs. They are used for hypertension or treatment of the heart failure. Now, several particular sports like archery or automobile, billiards, darts, golf, snowboarding, different games are there. The detailed list is given on the WADA website. Okay, so visit WADA website for the detailed description of this. Now, coming to the point of testing or control. This is called as control. How the testing is done. Now, in the phase 1 or in the first step, there will be the athlete selection. The WADA or NADA, whomsoever is the agency involved in that particular competition, they will select the athlete randomly. So, based on at any time, anywhere, a random selection may be there from a team or from a group. One or few selections will be there. So, say this sportsman, the third one is randomly selected for the doping test. Now, this particular sportsman will be notified by the drug control officer that the doping test is scheduled on such and such date, and you are bound to come for submitting the sample. If he refuses to submit the sample, guilty. If he accepts the invitation and doesn't come, guilty. So he has to come there. Okay, so there will be doping control test. So the sportsman is required to go to there. Now here there will be several containers kept in the doping control laboratory. Several containers. Now to remove the bias, or if somebody may feel that if the container is given and it is containing that particular drug, so they have trapped me in this trap. So it is the duty of the sportsman that the sportsman will randomly select one container. Okay, it will not be given to the sportsman. So the sportsman will collect the container for urine collection. And now in the next step, in the fifth step, the drug control officer of the same gender will observe that the urine is coming from the body of the sportsman. Okay, because of the earlier malpractices, this step is added. So the person or the officer of the same gender will observe. Now here the clothes will be removed from the navel. ओके, नाभीपासून क्लोथ्स पूर्ण हे केले जातात आणि खांद्यापासून पूर्ण ज्या स्लीव्ज आहेत त्या वर घेतल्या जातात. सो इट इज क्लिअर दॅट दिस पर्सन इज नॉट ॲडिंग द सॅम्पल फ्रॉम एनी अदर कंटेनर इन टू द कंटेनर. सो in the presence of the officer, the urine sample is collected. This step is highly debatable because it again the human rights and all these things will come here. Okay, so the 90 ml of urine will be collected in the container, and this urine, it will be kept in two different, or it will be sealed in two different bottles. These bottles will be named as bottle A and bottle B, or container sample A and sample B. That will be the naming. Now why it is so, we will see in the next slide. So these samples will be collected and the report will be generated by the DCO, drug control officer. That is the process where the sample collection is now completed. Now once the sample is collected, its certain basic characteristics like specific gravity, density, all these it will be done in the laboratory only. And for the further investigation for the presence of the drug metabolite or any kind of masking agent, the sample will be sent to a highly specialized laboratory where sample A bottle will be, only A will be opened. B will be kept as it is. So sample A bottle will be opened. Some analytical tests will be done. In the preliminary test, if the sample is found to be it is containing, say, some kind of prohibited substance, so another test will be done for the confirmation. So it is a two-step confirmation. So in two step, the sample A will be the presence of prohibited substances will be confirmed in sample A. Now if sample A is now the agency has confirmed that this is containing the prohibited drug, prohibited substance, it will be notified to the sportsman that you are found guilty. Now the sportsman has a right to claim that I want a retesting. If the sportsman claims for the retesting, sample B will be used for the retesting of it. Okay, so it is for the claim raised by the sportsman. So if there is any case, so sample A and sample B are separately. Now coming to the question of Wasim Akram, that insulin is a prohibited substance. The person is suffering from diabetes. So how can we stop that diabetic sportsman from participating in the sports competitions? Okay, so basically there is one provision made by World Anti-Doping Agency of TUE, that is therapeutic use exemption. If it is proven that, or it is certified by the authorities that this particular insulin or particular drug, say the person is suffering from hypertension and still wants to play, and the person is given beta blockers. So if beta blockers are given for hypertension, insulin is given for diabetes, or there is some renal kidney related disorder and diuretics are given. So if the doctor certifies this, if a medical practitioner certifies this, that this is being used for the treatment, this is being used for the therapeutic purpose, this exemption can be done, or it can be issued. TUE can be issued by the TUEC, Therapeutic Use Exemption Committee. So, okay, this has to be done prior to the competition. Means we cannot claim after finding guilty की सापडला तर तुम्ही नाही नाही मी आधीच मला डायबिटीस होता म्हणून मी हे घेतलं होतं, नंतर नाही सांगायचं. बिफोर whenever you are detected as the patient of that particular disease and that drug is being used, it is your responsibility, it is the responsibility of the sportsman, it is the responsibility of that sports agency to issue that or to proceed for the TUE certification. So that is the provision in the rules of WADA.
Sir, you have 5 minutes.
Yes, yes. Now, what are the athletes' responsibility? Athletes are responsible for whenever a prohibited substance is found in their body specimens. So, nobody else is responsible for it. Not coach, not agency, not your parents, doctors. Okay, so that is your responsibility. Now, it is responsibility of the athletes to know the do's and don'ts of the doping. Okay, at the same time, the sports authorities, they can also take the initiative. Just like I found this booklet from Australian Sports Agency. They have issued one booklet about, it is a wallet card showing the entire list of common prohibited drug, updated list of prohibited drugs. So we, as a sports agency, any agency can also go for such kind of activity, give the updated information. At the same time, the sports agencies can give a personal consultant for a sportsman, where even a sportsman suffers from common cold, he will go to that personal consultant or authorized consultant and get the authorized medicine, which is not included in the WADA list, okay, prohibited list. At the end, you must be, we talked about ethics. So basically, ethically, a sportsman should be so strong that there should not be any kind of doping related activities, intentionally, unintentionally. Your integrity should be such that a bookie will say that we cannot fix a match if Sachin Tendulkar is playing on the field. Okay, so that should be your integrity. Thank you.
Thank you very much, sir. Dr. Yogesh Thorat from College of Pharmacy, Solapur, has delivered his lecture on sports medicine and anti-doping in sports, health and fitness. He has elaborated and he has discussed on sports medicine versus doping, few news updates, doping on sports, health and fitness, examples related, and few lessons to learn from elite athletes, anti-doping rule violations, prohibited substances and methods, list of prohibited substances, methods for all times, substances and methods prohibited in competition, then substances prohibited in particular sports, testing, control, test results and claims, therapeutic use exemptions, and lastly he concluded his lecture with the athlete's responsibility to do's and don'ts. So thank you very much from on behalf of the organizers. If from delegates, if you have any questions, may proceed with the questions. Thank you.
Thank you, Doctor, for your presentation. We have enlightened by this. I would like to know about how the gene doping and cell doping are done, and what are the adverse effects on the sports performance, and what are the techniques to detect these?
Okay. Frankly, sir, I'm a pharmacist, so I have studied the drug related part. Gene comes under biotechnology, so frankly I don't know that.
A big clap for the honest answer, because this is the first time that any resource person has lively admitted that he is unable to answer. Thank you, sir, for your greatness.
Thank you,
and hope so everyone has been enlightened with his lecture. Now I request Manali Kane madam, doctor, to please proceed with your presentation. Dr. Pradeep Deshmukh, sir, I request you to please chair the session.
Good morning all. I can understand your situation as neck-to-neck sessions are there and you are from the physical active personalities and you are actually, you are not. You are active physical personalities and आप एक जगह बैठे हुए. So I request you all please stand up at your place. Relax your body. We have a lot of session on it, na? Doping and all. So we need some relaxation. So feel free. Just stretch yourself upward, sidewards, right side, left side. What is the benefit of this activity? Can anyone tell? Yes, very nice relaxation of muscles. One thing, it improves your circulation. Second, third thing, which is most important, apart of all these activities or the knowledge you get from session, 2 days sessions, the most important thing is mental relaxation and acceptance. Someone कोई forcefully one neck by neck एक के बाद एक ऐसे sessions are sessions. Either it is physical activity sessions or it is mental activity sessions. It needs some break. Like CPU क्या करता है थोड़ी देर बाद? Sleeping mode में जाता है. So like our brain and body need some energy after every 30 minutes. What is the scientific timing? That is 30 minutes. So when you perform any physical activity as well as mental activity, you have a relaxing time. For your students also. 30 minutes में 1 minute song, music, कल हमने पढ़ा था. So music therapy for 1 minute हो सकता है. 1 minute is a very short time. But it is a long for the relaxation time. So we have to do this and we adopt this practice. Actually, I did in my class also. Many students are here. So I always perform some activities after every 30 minutes or I share some interesting part. और सबको ना किसी का पर्सनल सुनने में बड़ा मजा आता है. I always said, it happens with me. And at the end of the day, I told, many things are not with me. But you people are connected with me, so you appeal it. You connect with me. And this is the technique. I think that is my first lesson to you all. So, please be seated. Your circulation enhances. Your performance also increase. So, आपने देखा होगा many times army training में no connection is there. And connection only builds with responsibility, with what can you add it? When you connect with someone, whether you respect, you hate में भी इसलिए बोला गया है कि विरुद्ध भक्ति, विरोधी भक्ति. So bhakti is there. So you always connect and you should. Now I welcome you all in my session and now my time starts. It is only for the 20 minutes.
Sport nutrition.
Good morning all. First of all, I will welcome you on today's session. I must thank to the Honorable Vice Chancellor, Solapur University, Dr. Mundaniri Fadnavis Madam, to give me the opportunity to share my views with people like you. Very intelligent people I have. Then, my sincere thanks to conference convener, Principal Dr. Lakshman Patil sir, conference coordinator Dr. Atul Lakde sir, and the entire team of Yashwantrao Chauhan Mahila महाविद्यालय करमाला, एंड कल ही मुझे पता चला कि वो अपने आप को कहते हैं यशवंत परिवार. सो आई वेलकम, आई एम वेरी मच थैंकफुल ऑल्सो टू यशवंत परिवार टू गिविंग मी सच अ वंडरफुल अपॉर्चुनिटी. ये पढ़ने के लिए मुझे हमेशा ज़रूरत लगती है कागज़ की. जैसे सर फंबल होते हैं मेरे नाम में, मैं कई बार इसी पार्ट में फंबल हो जाती हूँ. सो नाउ द माय सेशन स्टार्ट्स. इथून होणार आहे. So sports nutrition and high performances. Sports nutrition and high performances. As we heard that word from yesterday, high performance, doping and everything, is our ultimate goal is to increase the performance, isn't it? So nutrition is one of the part. So my question is, when the physical activity, or what is the age when a person starts physical activity? Answer from your side, I expect. कुछ loudly बोल सकते हैं, सुनाई देती है आवाज. When physical activity begins? Before birth is the right answer. Because क्योंकि क्या हो रहा है? Nowadays many parents want that his or her child become a sports person. But the early life, what about the early life? When the physical growths are optimized or maximized, at that age, the boy or the girl is in the protection. नहीं भाई कुछ नहीं करना है, नहीं ज़्यादा दौड़ना, नहीं गिरना नहीं है, बच्चा रोए तो तकलीफ है. There are so many wrong concepts in the minds of the parents. What happens? What is the impact? Child is more caring, है ना, उसको पता ही नहीं है कि कोई कुछ बोल देता है. And these are actually the reasons behind the mental toughness are lacking in young generation as well as parents also. So when the baby is in the womb, actually first kick बोलते हैं pregnancy में mother feel करती है. So at that time physical activity is needed and it is the sign of the liveliness. That is the sign of life. So if the life comes when you are in the physical active mood. What is the endurance or the physical activity or the sports person, athlete person? Is there any broad difference? No. The sportsman must be a healthy human being first, and then he will be the good sports person. When he is a balanced personality, good nutritional status, good physical and emotional, and the most important thing is social connections or the social health is also important. If we had all the parameters in his personality, then he will become a good sports person. So this is, I just want to share this. A healthy man is in the standing in the center. He is doing some physical activity for the good health, and sports person is trained particularly for that physical activity, and the physical activity enhances many metabolic processes including growth, maintenance, everything. So yesterday's session we already learned that the time of the physical education starts early in the childhood. And sir ने कल बताया था कि 20 years we need to spend to achieve something. It is not a game of a day or a month or a year. So we have to work on the early ages. Now sir ने भी जैसे पूछा था कि genes का और इसका, so I want to share one thing. New science which is in the field of nutrition, nano nutrition is developed, and it has been proven now when your mother's blood count or the micronutrient content affect the gene adoption. So maybe the doping the criteria is changed in near future. So now the awareness, तो वो सोचते हैं कि folic acid यदि रहता है तो जीन का जो dominance रहता है ना mother और father का, so which gene is dominant, so we can make healthy people or poor people or unhealthy people. So this is actually a good thing as well as it's a bad thing also. So these are some actually horizons. So we get, I just introduced food groups, because food everyone know, whatever we eat for the healthy body, eat and drink to build a normal nutritional status or to normal physical activities, we need nutrients, and we get nutrients from these foods only. So foods are classified into broadly in the 4 year. Actually I told always different type of food group classification. Just I am explaining you. That is, first is the cereal and millets. Cereal and millets are basic source of energy. Basic source of energy, they having a good amount of protein but not the high quality protein, which is I explain in the next slide. So and again millets अभी बहुत ज़्यादा चल रहा है. Millets everywhere we hear about millets. So millets, the importance of millets is also there, but I always said it has the many anti-nutrient properties. So consumption of millets for sports person, exclusive consumption is prohibited. Millets should be consumed traditionally. It should be fermented, it should be soaked, which enhance the bioavailability of the nutrients for which we consume it. So like only bhakri is not at all recommended. It definitely they decrease your glucose level and all. But for the sports endurance, it is not recommended. It should be fermented, well soaked, like ambil preparations. और साउथ में सबसे ज़्यादा काम हुआ है millets पर. Actually scientific work is done only in the south, on the millets. So millets को भी आप ले सकते हो. Then आता है pulses. Pulses are again the rich source of proteins. योगा की बात हो रही थी, हमने बहुत सारा सुना. तो योगा में कल मैंने मैडम से बोला था कि exercise is one part, but yoga consists in many things. Lifestyle, food acceptance, everything is included the yoga. Okay, so we generally talk about the physical activity only, which is which we call physical activity or endurance, है? But yoga includes many things, and actually यहाँ हम जा नहीं पा रहे. We have to reach that exact, accurate and complete yogic practices for healthy living being. So modern nutrition also includes some part which is very healthy. So protein again. So protein is very important. I discussed it in later. So a good source. Indians generally are vegetarians and must include pulses as a source of proteins, which is important for the bodybuilding processes. The third thing, that is milk and milk products or animal products. That is also a good source of protein and vitamins also. Then vegetables and fruit, which is most important, it is a good source of micronutrient and simple sugars. Simple sugars. Then oil fruits, I just skip it. Then athlete pyramid. Then nutrients, I will take it in the broad. So macronutrient, which is protein, carbohydrate, water, fat, I will take it later. Just we discuss about the micronutrient, that is vitamins and minerals, which is the most important part, because many vitamins, like when you are trying to increase the physical activity or the endurance or the performances, doping is required for the RBC formation, also for the increased oxidative oxidation or for the increased oxygen carrying capacity. So many nutrient plays in it. So we must take high vitamin C, high vitamin E diet, and as well as antioxidants like vitamin A. So these vitamins are very important. As we all know, RBC have a 120 days life. But the life should be good. So your nutrient level definitely maintains the RBC life, the oxygen carrying capacity. So we need these micronutrients in a good amount. Then vitamin B1. During the endurance we know we need energy. And for the energy requirement or when glucose burnt, insulin is one part which helps to penetrate the glucose molecule or glucose moiety into the mitochondria, and for the oxidation process there is an increased requirement of vitamin B1, B2, B3 which is known as thiamine, riboflavin and niacin, which we get from the pulses or whole legumes, flesh. So these are the good sources of this type of vitamins. So we must need vitamin B1, B2 for the proper oxidation or the proper proper oxidation I can say. So proper oxidation of the glucose moiety. Chemistry में नहीं जाती हूँ मैं, बहुत लंबा है. Because actually during the physical activity your chemical reactions increase in many folds inside the body, which need that micronutrients actually, and that is the importance of nutrients. So first I will take carbohydrate. We know carbohydrate is very essential. That is the only fluid for the all vital organs like brain, liver, kidney, RBC especially. They can oxidized or for the energy purposes. These organs require glucose moiety only. So you take glucose or not, it should be prepared by your body for its own requirement. So this is again a very wrong practice or wrong thing. Carbohydrate removal diet, which is very dangerous for the sports person. So I request you, didn't omit any type of carbohydrate. Just I am explaining you in a simple three classification. Monosaccharide, which is absorbable more fast, which is the instant source of energy, like glucose powder for example. Means sweetest the taste, increase the bioavailability or easy bioavailability and increase the oxidation. So for the sports drink purposes, glucose for sports drink preparations, आपने देखे होंगे पढ़े होंगे बहुत सारे. So glucose or fructose is one part of that preparation because it provides instant energy which is needed or which boosts your performance. But to recover or to turn over the glycogen depletion level, you need complex carbohydrate like आपका जितना cereals है, pulses है, roots and tubers है. So we have to include these food products in our regular meal to replenish the glycogen losses. Okay. So there are some other. It's a very huge topic. So just I skip some points. I will discuss it in later. So fats is also very important part. हमको पता है कि fats is also a dense source of energy and 1 gram fat provides 9 kilocalories. It is a theoretical, it is right. But what happens inside the body during the biochemical processes? We get a very little amount. I have to reconstruct my sentence. That fat is not at all always available as an energy source. So instant energy source is glycogen. But that fat is metabolized only in the presence of carbohydrate. Got it? And that fat is also very important for the performance or boost the performance if you consume fat-free diet for a long time. Short time it is accepted. And we will discuss it later. But in a regular meal, you should not skip the fats because it is also very integral part of your hormones, particularly sex hormones, as well as it is very important for the healthy epithelial tissue formation, It is also very important for the proper digestion and absorption or health of the small intestine also, which is the part. आपने बहुत खाया, but digestibility कहाँ गई? So it doesn't matter the how amount you need, the how you physically fit to absorb the thing. That is also important, and fat works for it, and it is a very important and integral. It has to be integral part of your meal. So one thing, यहाँ पर है क्या? We'll see. If your diet is deficient in fat, it sometimes it decreases your testosterone level, which affects the physical output or the performance. So the fat should be included. It also increase irritability if your diet is deficient. So it is some studies are there which showed fat is also very required nutrient to make your mind calm. So for the physical active person, over intake I never suggest. Ati sarvatra varjayat. Always remember this thing. So what I said everything is in the normal quantity. So ati means excess should not be prescribed at any cost, or either deficiency or excess. So this is a very important part. Many times we skip this. When we talk about the performances or endurance or the increased results, everything we for the results. Doping or the substances which increase the circulation, which increase the physical activity. We need this, but we can need or we can fulfill this by increasing stamina. What is stamina? We always said about the stamina. Please कोई कुछ बोलेगा? Technical, but what happens inside the body? When you are trained yourself, what happens inside the body? We should know it. That is the basic things which we don't know. We are doing so many things. We eat food, but we can't explain what is the food. We drink so many waters, but what is the need of water? We don't know. So, what happens inside the body? Then and then only you can train the people in a right way. Nobody knows, na? No, I'm not talking about this. But what happens when you train your body? What happens inside the body?
It uses fats as fuel.
No. I'm not explaining it. See, I'm just explaining in a very simple way. Now I'm unfit. Suppose. Just I start my physical life at this age. What happens? I can able to run only on this area. That's 200, 300 meters. After these 7 days, if I run 200, 300 meters every day, fourth day, naturally, I can increase my length of running. Means at that time, which is very important point, at that time your body learned. Your body, ये कोई उसको कोई जरूरत नहीं है सब थ्योरी की जो हम पढ़ रहे हैं. He trained himself. Already भगवान ने हमको trained भेजा है. So our body don't need of any classes. So that is the self-learning. Body can self-learned person. So वो खुद भागती है, वो सोचती है कि अच्छा which type of oxygen I needed. First day जल्दी थक गई. Second day reconstruction of the many anabolic processes inside the body runs. And body automatically reset its clock. So it boosts. अब उसको पता चल गया कि क्या करना है. So the reserve is more. It increases the body reserves of the glycogen only, muscle mass only. Fat accumulation is not at that extent much, but these two nutrients are stored inside the body. Physiology पढ़ा होगा. In the cell, mitochondria, number of mitochondria are there, and when you are trained yourself, the number of mitochondria is more in the more active cells. More inactive cells having the less mitochondria, that is the storage, in the store energy storage in your body. So you need to know this first. And during that endurance, we are actually not needed to do so many things, but the hydration is equally important, which is the very much neglected part. And many times I told in the conferences or in the club कि बच्चे हैं, so children, हम किसको train करते हैं? Children को. So children have the highest body water percent, and during exercise water losses are more. And हम क्या करते हैं उनको ट्रेनिंग में? Don't drink water in between the training. Don't drink water. And बच्चा क्या करता है घर आके? थक जाता है, बैग डालता है, सो जाता है. That is the reason why parents are not actually support these two fields together, study and sports. The reason is parents बोलते हैं नहीं बच्चा घर आता है कुछ पढ़ता नहीं है. And वो कब पढ़ेगा? जब its nutrient requirement is fulfilled, because we don't need any anabolism. It is already set. You provide the things, you provide the nutrients, all things are running automatically inside the body. So the dehydration and the stomach training is more important part, which is most neglected in India. अभी भी because कोई ट्रेनिंग में करना नहीं चला, अभी बड़ी-बड़ी जगह पर आ चुका है. So replenishment उनको क्या करना है? खेलने आने से पहले 4 घंटा पहले उनको बोलना अच्छे से पानी पी के, इतना पानी पिए कि, और सिर्फ पानी is not the requirement, because when your water losses are there is a sodium and potassium loss is also there. So but potassium again it is a very unique creation बोल सकते हैं. Whenever glycogen stored inside the body, it is always stored with potassium. Potassium works for the relaxation. So, and when glycogen is broken down, again that potassium is released. So, potassium level is always maintained in the blood. Generally, the losses of the sodium. So, we have to include the sodium, water, and vitamin C inside the preparations or drink preparations. है ना? आहे माझं लक्ष 20 मिनिटात संपेल. नाही मी एवढं बोर नाही करणार कोणाला. आई नो दी कॅपॅसिटी. सो मैंने बोला था ना कि बस अभी 5 मिनट और है. So that is aerobic and anaerobic oxidation is most important thing. Aerobic oxidation means the oxidative oxidation which is required for the performance only. And all the doping जो है आपके जितने भी substances है that increases circulation and promotes the oxidative oxidation. But doing the yogasanas, doing the stretching exercises, we already increase the oxidative oxidation or oxygen carrying capacity of the lung, and which ultimately in turn in the best performance. But only oxidative oxidation is never works. With glycogen moiety it is very important, or glucose moiety it requires, and so we have to include glucose or sugars in solutions. So these are some examples आप लोग ले सकते हो, मैंने इसलिए बड़े-बड़े स्लाइड बनाए. So this is the omega 3, omega 6, but I request don't take in a large amount. If they are in the controlled, they are boosting your metabolism. It acts as a क्या कर रहा है ये? Nervous stability, but means anti-inflammatory. But if you consume in a large amount, it increases the inflammation. So restrict it. So protein incomplete, this is not today's topic. Then the fluid, and the most important thing is clearance. This I am not going through it. I want to tell you one thing. Lactic acid clearance, which is most important to increase the performance. So what is the lactic acid? Anaerobic oxidation, which is majority performed inside the cell, skeletal muscle particularly. So during your exercise, lactic acid preparations are more, which increases the acidic pH, or it increases the acidity of your blood plasma or blood. So that clearance is very important, and that is the importance of proteins. Proteins also plays a very vital role, because protein have buffering action, and that buffering means they turn acidic into alkali, alkali into acid. So that buffering action creates or the help to maintain the normal lactic acid levels. If you consume well hydrated or if you consume proper amount of fluids, it also helps to maintain the lactic acid levels inside the blood. Because when lactic acid accumulates inside the cell, it decreases your performances by less by or 50%. So that lactic acid clearance is most important, and that's why you must consume fat moiety, carbohydrates as well as fluid concentrations, or it has to be must the integral part of your meal during the performances. So that is, I think, in the given time, I just want to sum up or include some important points. And if you need this PPT, please ask Atul sir. He will provide you all the things. So, thank you all.
Thank you, madam. Dr. Manali Kane, Sports Nutrition and High Performance was her lecture. She described on movement initiation is from mother's womb, nanonutrients, concepts, emergence, food groups and main nutrients, which are of 4 types, pyramids of foods for athletes, nutrients, especially micronutrients, carbohydrate, fats and proteins, consumption of all things in limitations. She also enlightened on oxidation by aerobic and anaerobic process, then omega fat, and lastly she concluded on lactic acid clearance. Thank you very much, ma'am. I have a question regarding, I have heard about polymerized glucose. Many athletes consume polymerized glucose during their sessions, that is competition. Can you just elaborate it, what is polymerized glucose?
It is a chain of the glucose. If you consume simple sugar or glucose molecule, it increases your blood glucose level very fast. And at that time congestion may be there. So the moiety आप बोल रहे हो, it increases slowly glucose moiety, which acts as a long-term fluid, long-term energy resource. So that's why they consume. Otherwise normal sports drinks में एक जनरल आपको एक फॉर्मूला बताओ, 1 liter वाटर आप अपने सारे स्टूडेंट्स को बोलिए, they will carry this with always with them. 1 liter water, 20 or 30 gram sugar, then a half teaspoon sodium और हमारा साधा नमक, okay, and they will carry this 1 bottle and 1 bottle plain. Same time the nutrient which I have actually forgotten, कल बोला भी था उन्होंने कि the absorption of the nutrients means whenever your session is over, you should consume food within 30 minutes which maximize the absorption. ये सारी जितने भी हम लॉ पढ़ते हैं ना, शरीर डिनाई कर देता है. तो 30 minutes में कोई लॉ काम नहीं करता. It works till 2 hours. So within 2 hours, whatever you eat, it is maximum absorbed. So that is the importance of the food intake.
Thank you, ma'am. One more thing I would like to add. I have gone through the book Nutritive Values of Indian Foods by NIN. So I think it is just fantastic book which is to be prescribed for everybody. Till today, I have given the book as gift for 337 people. So it was just a fantastic book. May I now ask the delegates to have their questions?
No question.
Okay,
Food
you
is more
are eager
required.
to have nutritious food in the lunch. So I request Pradeep sir to have some deliberation.
We have a medical student who is studying in the final year. She is completing her MBBS. So she is totally different from our faculty. So we'll have a special presentation of hers, and after her presentation, we'll go on to the nutritional practicals. So I request Sania Patil to give a presentation. I respect Deshmukh sir to please chair the session.
Hello. So, good afternoon, everyone. I am Sania Patil. I am a final year MBBS student, and I'm from here, Solapur. So, my today's topic will be on doping. Against doping. But all of them were saying like doping is very bad, and yoga, we should practice yoga every day. But you may ask, why should we do yoga? Like, okay, it's good, but what is the use of it, and how does it actually channel our body to be, in a healthy state? So, I may be talking about the anatomy, how yoga helps us internally, and what is the actual effect of yoga on our body. So, let's start, and I'm gonna wrap it up quickly so you won't get bored. So, yoga is medical scientific model for sports. So, if we give this model to the sports person, so instead of doping, they'll be already energetic by doing yoga. So, let's start. So, today's abstract. What is today's abstract? That does yoga provides a reliable model for the sports person, and it is really reliable, and we can totally depend on it, as it is has no side effects and is very cheap. And so the usefulness of yoga in real life. So as a medical student, I can guarantee you that yoga helps you in every aspect of your life, not only mental, physical, but also helps you in management of time and your daily activities, and improves your strength and everything. And then as this time period, we are going to see getting more doping cases, like more advancing medicines, more doping cases, more hiding cases, etc. And then so what are the keywords for today? They are only yoga, sympathetic and parasympathetic system. So sympathetic and parasympathetic system is very important in today's presentation, because the whole play goes in the system. By doing yoga, this is a system which is very essential in our day-to-day life activity. Means this system controls our whole body, and of course nerves and hormones. So let's start. Introduction. Some individuals choose to use drugs for stimulating body, of course, but as you stimulate body, there can be many side effects. Doping side effects. What are you can have strokes, because there is increase in cardiac activity, increased blood pumping, so there can be stroke in our head, and of course heart diseases. Then we have even embolism. You know what is embolism? Anyone? Embolism is a small clot of a blood or anything that obstructs our artery, and that can cause death of a tissue or a cell. For example, there is embolism in our head. Okay, so it obstructs our blood supply to the brain. So what does it cause? Ischemia. Ischemia is what? Necrosis of a tissue. So it will be death of the tissue in our brain. So of course decrease in motor stimulation in our body. And then we have, if a sports person gets trained about body parts and their working system in brief, and how yoga helps our body along with sports training, he will definitely avoid using dopa. But to achieve this, how can we achieve how can we convey the sports person to do yoga instead of doping? It may be hard, because they are like, why we should do yoga? Doping is really convenient, but it is banned as it has many side effects, and it can get the sports person may have more advantage than the other person, so it is ethically and morally wrong. But yoga is very very useful, and I myself do yoga every day. At least I give myself 1 hour, and then to convey this message to a sports person. First, educating the coaches. Second, awareness campaign should be done, and free courses should be done in the whatever facilities or whatever they are like stadiums and all. It should be conducted. And after that, it is always interesting to see how yoga can help in sports scientifically and not religiously. So let me tell you clearly that yoga is nothing superstition. It is not that, oh, you have to clearly believe in God to do yoga. No, it is not like that. So you have to, it should be explained scientifically, from internally, anatomically, how does it help, as well as physically and biochemically. How does it help our body? It's not just religiously, oh, I should believe in God. Let's see, if a person is atheist in a sport, he won't believe in God, so he's like, why should I do yoga? It has God chanting and all. It is not like that. So moving forward, so let me explain you. This is our brain, right? So it is cut in half. So you can see there are many this. No. Okay. So this is our brain, right? So we cut it longitudinally. So you can see this is cerebrum. That is frontal, parietal, occipital, and temporal lobes. Right, like this. So what does yoga help? Mainly this part. This is the pituitary. You can see over here. Next slide. But okay, amygdala. This is the amygdala part, just above the temporal. So what is amygdala? It is the part of a body which it is part of the brain which controls all our emotions, starting from love, fear, hate. Even you fear your mother, the system gets activated very much. And then okay, so how can we control these emotions? They tell you that you should not make decisions in when you're sad, angry, because you can make wrong decisions. So how should we control our feelings, emotions? So by very simple answer, by doing yoga. Many people have depression. Hormones are unable to maintain their proper equilibrium in their head, so they go for antidepressant like Serta and etc. I've seen many patients in our hospital. They, even my colleagues, have, some of them suffer from depression and all. So the most simple thing is yoga is very easy to do, and it has no side effects like antidepressant can cause obesity, because it increases the water levels in our body. So but of course our body is gonna get more water, so more water leads to what? Edema in our body. Then even dependency also can occur. Some people take more and more antidepressant, and they get addicted to it, so then they have to go to rehab again. The all process starts. So yoga is a simple word which has many benefits to it. So now, okay, this is the brain, of course, and this is the pituitary gland over here. So what is pituitary gland? It is a small gland just in front of our eyes, and like in between your eyebrow region. It's called actually gazeba. So it is situated right between your eyebrows. So you see chakra. In yoga they say people focus on your chakra. Focus on your chakra. Why they say that? Because pituitary gland is situated there, and majority of hormone production is secreted from the pituitary gland, and it is one of the important centers in our brain. And as you can see, we can regulate it by doing yoga. So those who are depressed, those who are very anxious, tired, anxiety can solve by doing yoga. And some people take antidepressants to stimulate the pituitary gland also. And as you can see, this is the emotional center, right? Amygdala. So So once we see see, this is the brain. So this is the neuron. It is the functional unit of our brain. This is the neuron, right? Neuron. In neuron, we need serotonin to control our day-to-day lives. If serotonin is not there, we go in depression. So instead of taking drugs, yoga is the answer. And what does yoga control in our body? Like what system does it affect to give so much advantage to us? So first of all, two systems are there in our body, means systems which are controlled by nerves. So what are the two types of nerves? We go with parasympathetic and sympathetic. So think like that. When you're scared of someone, or imagine that your teacher is sitting in front of you, or your mother, when she's angry, she's sitting in front of you. So quickly your sympathetic nerve system gets activated. So when it gets activated, there is increase in heartbeat, and there is dilation of pupils. Can you see in you can see your eye, right? So there is a iris, which is colored part. Some can be brown or blue, whatever. And between our eyes there is a small point. You can see it's a pupil. So pupils get dilated, and then there is relaxation of the airways. So oxygen content is going more in our body. Inhibition of gallbladder, inhibit activity of stomach. So the stomach activity is reduced, and more gastric secretions are reduced. And so inhibit activity of intestines, secrete epinephrine and norepinephrine, which is good sometimes, but it is only good when we are in fight and flight mode. Like when you see a tiger in front of you and you have to run, so quickly your sympathetic nerve starts with fight or flight system in your body. So it gives a signal, run, let's run, there's a tiger in front of us. So meditation stimulates our sympathetic nerves, right? So you can see it's connected to everything. Eyes to our kidneys, everything is controlled by a sympathetic nerve, right? Next, when you are relaxed, when you are chilling Netflix and chilling in your house, so what does it stimulate? Parasympathetic nerves. You're relaxed, contracted pupils, right? And then stomach salivation stimulation is there, and contraction airways, so everything is relaxed. But what the main nerve in our body is vagus nerve. Vagus nerve controls everything, and it is the biggest nerve in all. So when yoga comes, imagine that vagus nerve comes, because vagus nerve is the most important nerve in our body. And what does it control? Almost everything in our body. So what does yoga do? Stimulate the vagus nerve. When you stimulate the vagus nerve, our hormones get secreted properly in more proper rhythm. And you may say some may have insomnia. What is insomnia? You cannot sleep at night. Why you can sleep at night? You have stress. It may be because of some defect in secretion of hormone. So insomnia even can be cured with doing yoga, as the hormone by which sleep is induced is secreted to the pituitary gland. It is melanin. So of course, by doing yoga, melanin is secreted in a proper rhythm, so you can get sleep at night properly. So as you can see, the nerves, parasympathetic and sympathetic, all functions are given here. So okay, what does it do? First of all, this is kidneys, lungs, then stomach, then other organs, sex organs and everything. So what does steroid do? Steroids gives us mood swings and aggression, memory, concentration problems. It is very hard to concentrate in schools or whatever. Even nowadays children are suffering a lot from concentration problems. And narcotics. Okay, why narcotics? It is the most harmful substance to our body. What does narcotics do? Gives us depression. It gives a sensation of euphoria, like you're floating on clouds. And then hormones, visual disorders, nausea can be okay. Nausea. What is nausea? Sensation of vomiting, but there is no puking reflex. So it is situated in brain right itself behind in the medulla. It's in the brain only. So everything in the body is controlled in our brain, and everything in our brain has a few locations where it is controlled. So our personality is controlled from our frontal lobe. Our personality traits, everything are right over here on the parietal lobe. So as you can see, diuretics causes dehydration. Kidney failure can also be done. Edema in our body. Okay, this is the neuron which controls the brain. It is the functional unit of our brain, and it controls our everything, not only lower muscles. Everything in our body is controlled by this neurons, but unfortunately it has no power of regeneration. Means once it dies, nothing can be done. So there is and even can you see small knobs down there? From the serotonin is exchanged to the next neuron. So like that, our body regulates it properly. But what happens in depression? This right over here. So there is another neuron here. Same like this here. So from this knob to another knob, but between this, it is called a synaptic limb. So when there is serotonin secretion, there is no uptake, right? There should be uptake to give to another neuron. So once serotonin is secreted, there is no uptake. So there is waste of serotonin in depression, and there is lower secretion of the serotonin that leads to depression, anxiety, and everything. So effects of yoga in our nervous system. So I have told you nervous system, parasympathetic and sympathetic nerves. So now the effects of yoga in our nervous system. So it is the effect of yoga. Can you see this all nerves? This amount of nerves are present in our body. The yellow color lines, these are our nerves. Even we have nerves on our ribs, these are called intercostal nerves. And nerves are spread throughout the body. So it controls everything. See, now I'm doing this, it is controlled by a nerve. The nerves send stimulation to our spinal cord, to our brain. It is done by nerves. So why yoga is needed to control our nerves? Because nerves also control the secretion to activity, hormonal system and everything. So next, influence of yoga on autonomic nervous system. So these are the studies which are done by scientists on yoga on our nervous system. So you can even go and search what are their research and all. Even in books are also published on the effects on nervous system. So what is yoga? As ma'am have told us what is yoga, so I'll just tell you in short. Yoga is nothing, just it is a union between mind and body. So basically we have to connect our mind to our body, right? If we are not in a rhythm with our body, we cannot progress in our life further. You feel lazy, no, you have mood swings, you cannot do work because you're feeling extremely lazy. So yoga can turn it, your life upside down. It is the best thing you can do to not yourself but for your body. So yoga has existed over 5,000 years, and it was it was invented and discovered in India itself, and it encompasses. So you can see there are two types. There are two classifications, or you can say there are two methods in yoga. First is breathing, which is postural breathing. The important thing is breathing. So why breathing is important? So when you breathe in oxygen, and when you exhale carbon dioxide. So why does our brain needs breathing? When you breathe out quickly, you give up excess toxic carbohydrate. Carbon dioxide, which is affecting your body, and toxins are collecting in your everything, your body. So while exhaling faster, you can exhale out carbon dioxide faster. So your body and your muscles feels energetic and have much oxygen saturation in your muscles. And then okay, and the state of being and the practice of yoga is a great art of living. I actually follow art of living. So it's a great institution where they have taught us many kriyas, and I totally recommended you. Even our college is offering us yoga classes and yoga sessions. So what does yoga do? So first of all, it increases your immune system. It can later on change even your genetic composition. It is rare, but it can cure your diseases also, and it is scientific. It's just not anything magical or nothing. It is literally scientific. Research studies are done on it, and even Yale Universities, the top 10 Ivy League college, Yale has published their paper on yoga, and they are even telling their students to practice yoga. So it even has effect on psychoneuroimmunology. As I said, psychological effects are abundant. And next, benefits of yoga, as I told you, many effects. Increases your stamina, immune system, then control your emotions, better decision making, and it teaches you good values and morals in your life. And benefits of breathing, as you can see, oxygen is more reaching to your body. So more oxygen, more energy to your body, more stamina. So no use so why to use doping, right? And it has no side effects. So this is the asanas and the rest of the yogas. Asanas are only tip work, and the rest of yoga is just immense, and it takes practice. And as we practice, we get good. So our body is built very properly. And then we have a medical. Okay, so these models can be used for sports person. This asanas done by sports person can increase the stamina. And as you can see, there are many lectures, many sessions available on YouTube or whatever. You can see asanas. It energizes your nervous system. Then deep breathing, pranayama. Then deep breathing, as I said, more oxygen, less carbon dioxide, more energy, more stamina. So meditation, as you can see, it develops our whole body. Brain when vibrating, it is in the best mode. You get deep sleep, which with good cycle of sleep. Okay, so what is the conclusion? So our medical model. So my medical model is, first of all, yogasana, compulsory to be done, pranayam, and meditation. So just start with a little bit. Don't start, okay, let's do everything in one day. Start with meditation, then yoga, then pranayam. It will, as you build up, your body will be very strong. And then to control our brain, sympathetic, parasympathetic nerves, very essential, very essential of our body in day-to-day life. Having so much stress in our life, our body needs something that will keep us strong mentally as well as physically. Relationship problems, you can go in deep depression. Breakup stories I have heard, so you can go in depression. So for that also, yoga is very good. Thank you so much.
Thank you, ma'am. I would say that would-be doctor Miss Sania Patil has deliberated a lecture on yoga as medical scientific model for sports, and she has emphasized on nervous system of human body related to brain. She has explained on pituitary gland importance, sympathetic and parasympathetic nervous system. Meditation stimulates sympathetic system, vagus nerve, that is said to be sushumna in yoga language. Is it right, ma'am? Yeah. Cure of insomnia through yoga. Then it is steroid effects, then neuron control on our body and movements. effect of yoga in various nervous systems, regarding art of living you described, psycho neuroimmunology, benefits of yoga and nervous system, model for sports persons through yoga, asanas and pranayama, and you concluded the session for compulsion of yoga. So we take your inspiration and we'll do as you say. Yes, doctor. Thank you very much.
Thank you so much.
You have a splendid explanation. Thank you.
Thank you so much.
If
Thank
anybody
you.
is having question, so everybody is eager to have lunch. As Atul Lakade said that it's a nutritional lunch. Okay, so let's have the delicious lunch. Thank you very much.
Thank you.
We'll start our session at 2:30. That will be the last session of this international conference. And the presenters, please be ready with the PPTs. You may leave the hall for the lunch.